So as you just learned, aspirin is one of the most widely used drugs worldwide, and we've been using it in its current format since the really late 1800s, early 1900s. So what we're going to do first is we're going to look just specifically at aspirin. We're going to look at the chemical formula of it. We're going to talk about some of its benefits, some of its disadvantages, some of the concerns that we have, and bring that into the context of medicines. So as we mentioned, aspirin is one of the most widely used drugs that's available today. Up at the top, it actually has the chemical reaction to form aspirin. You start with salicylic acid. Remember, salicylic acid came from salicin. Salicin came from the willow bark. It was isolated from that. But salicylic acid is too corrosive to the stomach. We can't handle that. Salicylic acid is still used in some acne medications today. So what they do is they react it with this acetic anhydride. And they're looking for the little blue shaded in area. That's called an acetyl group that they're going to try to add. Now it looks kind of weird. These are line drawings. So remember, at the corner of each of these little lines, there's actually a little carbon sitting there. And then the carbon is surrounded by hydrogens to make sure it has 4 bonds. So they react these together and they get acetylsalicylic acid. It's kind of fun to say acetylsalicylic acid. That's just aspirin. And so this is an acetylated form of salicylic acid. And what they found is that this form, this acetylsalicylic acid, I've said it like 20 times, you should be able to say it now, is just more easily tolerated by the stomach. One of the byproducts of this is acetic acid. Acetic acid is in your vinegar. It's the active agent there. Now, like I said, aspirin is one of the most widely used of all drugs, and it has a lot of benefits. It's an antipyretic. Antipyretic means it reduces fevers. Anti, of course, means not or against or opposite. Pyretic is, well, have you ever been called a pyro because you like to play with fire? So we're going to reduce a fever. Analgesic is a pain reliever, analgesic, and anti-inflammatory is it's going to help reduce inflammation. So aspirin can do all of those things for you. So if you have a really bad headache and so you grab the aspirin and start taking aspirin, you want it to work immediately. But it does take time for that pain reliever to actually start working. So we're looking to see how long does it take to disintegrate. Earlier we talked about different forms that you could get the aspirin in, if it was a powdered form like it was originally sold, or a tablet or a gel cap. The gel caps have to be able to be dissolved by your stomach. So all of those will take slightly different amounts of time. So we want to see how fast it can get into your bloodstream. That's how long it's going to take. Now, one of the things that they've done is they have what are called buffered aspirins. And a buffer was originally designed to increase the rate of absorption. So it's not a true buffer system. They took acetylsalicylic acid and added magnesium carbonate, which is a base. And they were trying to have something that would have a narrow pH range. So it doesn't have a really high pH or a low pH. It takes longer to destroy the buffer solution, but the idea is that it would actually get into your bloodstream faster, so it would work faster. There is no evidence of greater or faster pain relief, although there have been some indications that it causes less stomach acidity in case you had any problems with that. Aspirin is considered to be a non-steroidal anti-inflammatory drug. Whew, that's a big old long term there. It's not the only one. Ibuprofen is also. There's several others, but that's what this term is referring to. So multiple things can be this non-steroidal anti-inflammatory drug. These are going to inhibit the formation of what they call prostaglandins. Now, prostaglandins were first discovered in, yeah, you guessed it, the prostate gland. However, prostaglandins are actually in virtually every tissue and fluid in male and females. So they participate in almost every bodily function. They play a role in the sensation of pain and its transmission along the nervous system, the generation of fevers and swelling and inflammation. Wow, can't get those words out. They have what is called an enzyme inhibition is the way they work. So what we're going to do is we're going to try to block the formation of these prostaglandins, and the prostaglandins are the ones that send out the signal, oh my goodness, you have a foreign object in your body, we need to run a fever. Or, oh my goodness, you just hit the wall, that hurt. I want to say it hurt. So we're going to try to stop the formation of the prostaglandins. Now, aspirin works because it's an enzyme inhibitor, meaning that it suppresses an enzyme's normal function. So when an enzyme does, and here we're trying to show the enzyme, so this is what the little pretend enzyme looks like, and inside it has this active spot, and so this active spot is a certain shape. So what'll happen is that something comes in and it fits in just right in that spot, and it forms a product. So here it is, it's fitting inside. I know it doesn't look like the square should fit inside the 1, 2, 3, was that an octagon there? It doesn't look like it should fit inside, but we're going to form some sort of product. And now for the prostaglandins, what we're talking about is this is that transmission of pain or fever or inflammation. Well, what aspirin will do, or your non-steroidal anti-inflammatory drugs, any sort of enzyme inhibitor, is, and this is the aspirin right here, it's going to block that enzyme spot. So when it blocks the enzyme spot, it doesn't allow that product to form. So it prevents the substrate entering the enzyme site to be changed into a product. So it stops that ability. But aspirin, as good as it is, does have some side effects. For instance, about 2 to 10% of people that take aspirin get upset stomachs. They have a problem. Remember, aspirin comes from salicylic acid, which we said we don't like to use internally because it's very corrosive. So even though we have the acetylated form, even though it's more tolerable, some people still have issues with it. Some people will have allergic reactions to it. Down the bottom, it talks about Reye's syndrome. It's usually within kids. And what will happen is that it causes a swelling of the brain, damage to the liver, confusion, irritability, nausea, lethargy. It can be lethal. It's a very rare disease. And so that's why they always say don't give aspirin to kids. So don't be confused. When it says a baby aspirin, it does not mean that the aspirin is for babies. It just means it's a smaller dose. So this Reye's syndrome was very, very prevalent. Again, it's very rare, but for those it affected, it was most prevalent in children and adolescents recovering from chickenpox, flu, and other viral infections where their body was already compromised. Now, just in case you're curious, that baby aspirin is 81 milligrams of active ingredient. Your normal aspirin has about 300 milligrams, and extra strength is about 500 milligrams of acetylsalicylic acid. Now, it will also inhibit the formation of blood platelets. So aspirin will prevent blood clotting. So if you accidentally cut yourself, what'll happen is that the platelets come in and they're like, oh my, we need to stop this bleeding. So they will clot to stop that bleeding. And what aspirin does is it says, okay, we're not recognizing that you're hurt, so we're not sending the blood platelets to be able to make the blood platelets to clot this spot. Well, that could be good or it could be bad. So if you don't have enough clotting that occurs, so if you don't have enough, this could lead to gastrointestinal bleeding because it's not clotting anything, it just allows the bleeding to occur. You could have increased bruising, increased risk of certain types of hemorrhagic strokes, that ruptures the small vessels in the brain. So they usually tell you to avoid aspirin before you do any surgery. So my husband is on actually an antiplatelet medication. He had some heart stents put in a few years ago, or actually just over a year ago. So if he gets hit, and I know my grandma was diabetic and she was the same way. So you barely hit them and they end up with these huge bruises. Well, those bruises are because a lot of the blood is pooling underneath, all sorts of good fun stuff here. It gives that nice colorful effect to it, because they don't have the clotting mechanism to stop that. But if you think you might be having a stroke or a heart attack, they say to take an aspirin. And my dad actually had that happen. He had a really bad migraine. Turned out it was a mini stroke, and he took some aspirin, and they think that may have saved his life because it helped everything out. So you just never know what's going to happen here. So aspirin can be good, but it does have some side effects.